So, good afternoon. My name is Josef Fontana. I am assistant at the Department of Medical Biochemistry, and I have this opening lecture with you. The lecture will have two parts. At the beginning, I will tell you something about the organization of the module, cellular basis of medicine. In the second part, I will show you some case report of some patient that is connected to the topic of the whole course. The topic of this first course is structure of the cell. So our patient will suffer from some problem in the structure of the cell. First, the opening lecture of each course will be different from the others. In the first lecture, we want to show you why it's important to learn the things from this course, and that also the doctors in clinical practice can use the knowledge even from the first course in the first year. Yes? Unfortunately, in our body can be defect everywhere. So also the defect can be in the structure of the cell. And I will show you how one small defect in one design leads to a very big problem in the whole body. Yes? So now try to imagine you are doctors, and a patient that is called John. I will tell you in 15 minutes story of John, and we will try to find out where's the problem and to see how one small organelle can do so many problems. So the question is, why has John kidney and heart problems and his hands hurt? So who's John and how he looks today? John is 40, but all people say that he is 55. So he's older, he looks like older. He has visited your department for inborn errors of metabolism for 10 years. So he has this disease quite old. But today's visit is for John different. For you as a doctor, he has to decide whether he has to start undergoing dialysis or whether this treatment can be postponed. You know what's dialysis? So dialysis is the method if you have disease of kidneys and they do not work. So with dialysis you can replace the function of kidneys. But maybe not now if you decide that the dialysis is not vital for you now. Once it will be vital for the disease steadily destroy the kidneys. So once it will be vital. John hopes that his heart, that is also sick, allows him to undergo kidney transplantation. There's other method how to replace the kidneys. For the patients with kidney transplantation have better life than the patients with dialysis. But even with new kidneys, he could not get rid of infusions. John has to go to your department every 14 days to gain some infusions. The infusions aren't very pleasant. Yes, he feels a bit sick after every infusion. After every 14 days, he feels sick. But since undergoing them, he feels better. Yes, he's not so tired, and he can also ride a bike. How it all began. So when you asked John, how was your childhood, he said that everything was strange. Even before school, he felt very often sick. He had very often diarrhea, especially after meal, after all meal. Yes. But when mother took him to doctors said there's nothing. Yes, nothing strange. Then, when he started going to school, he started suffering from pain. His hands and feet burned. He could not play games with other children. It's typical for a small boy. For the pain always comes when he starts playing. John was also often febrile, so he has high temperature. But he had no cold, no flu together. So the parents took him again to the doctor. And he said nothing. Yes, maybe some mild immunodeficiency, but nothing. The doctors thought that John might injure. Yes, for John also wasn't very good at school. But then they took John to the Department of Rheumatology, and there was John told that he has some kind of mild rheumatism. That's unspecified disease of connective tissues, yes, of your ligaments, tendons, and so on. Doctor gave him painkillers, drugs against pain. Yes, it helped a little bit, but not much. I already said John wasn't very good in the school. He was a clever boy, but he had quite often stayed at home, where he was ill. He was febrile and so on. After all, he finished high school, so he cannot go to university. And he started working. If you want to start working, you have to have entrance examination. Yes, for every word, the entrance examination. And in the entrance examination, the doctors found something. John had proteins in urine. Normally, we have only a very small amount of proteins in urine. And John had quite significant one. It's also strange if you are a young boy, that you have proteins in your urine. So, they sent him to nephrology. Nephrology is the department for kidney diseases, to be carefully monitored there. Also, the doctors found there nothing. He was satisfied, for John had new worries now. He had to make a living. Yes, he was a student. John coped with the problems alone for a few years, but then appeared new problems. He had strange red spots on his body, and the number of these spots grew. He had them on the chest, on the abdomen, and also on a place where no young male wanted them. Therefore, he went again to the doctor. Now, when you have a problem with skin, you go to the dermatologist. And it was this dermatologist, the 10th doctor in a row. John was about 25. And this doctor expressed this suspicion on diagnosis. They confirmed this diagnosis, for they took John's blood. And this diagnosis stayed with John the whole life. After the diagnosis, John thought about suicide. Yes, for he was said that he cannot cure from this disease. But with the help of family, colleagues, and doctors, he overcame it. In the last 10 years, John is your patient. And last 7 years, he has infusions every 14 days, for we have new treatment for him. But according to values, John has now, he has to start the dialysis, for the kidneys are very, very bad. And in addition, John has new problems. He has a heart problem. Very often he is out of breath. Yes, especially when he plays with a small ball. And also this is due to this disease. The only good thing John says is that his boy is healthy. And you as a doctor, you can say, yes, it's normal. All your sons will be healthy, but unfortunately all your daughters will have this disease. And you can say it, and you will see why. So do you think this is true story?
Yes.
Yes, it's quite unlikely that now in the 21st century, you have patients that has 23 years, 25 years problems from the childhood, and the 10th doctor in a row is able to do the diagnosis. This story was published last year in journal Medicine After Graduation in April. The article was called Fabry Disease More Common Than You Think. So it is the story from Czech Republic. But if you give Fabry disease to Google and Fabry disease and case reports, you will see plenty of these patients throughout the country. Still the same. Still the same symptoms. Nobody knows what is it. So John has Fabry disease. Fabry disease is quite rare disease. It's not so common as myocardial infarction, diabetes, hypertension. We call this disease inherited lysosomal storage disease. What this means, I will explain to you, and something you will tell to me also. The problem in this disease is quite simple. One defective enzyme. In the whole body everything is good, but one gene is defective. One enzyme, the enzyme is called alpha-galactosidase, and due to the mutation there is lower activity of the enzyme, or the enzyme is absolutely inactive. And what is also important for you, and this knowledge will help you to answer some of my questions, is that the gene for alpha-galactosidase is located on X chromosome. So my questions: what are lysosomes? What's their normal function in our body, in our cells? For digestion, where? For example, in stomach?
Sorry?
So, for example, for digestion in stomach?
No, inside the cell, specifically.
So they are organelles that are important for digestion, for the cell digestion. Really? Same. They are very small organelles. Here we have the normal size. They are only in animal cells, and we have many of them in the cells. They contain about 50 different enzymes that we call acid hydrolases. What's hydrolase?
Enzyme?
An enzyme that, yes, hydrolysis is degradation of something. You degrade some bond. And these hydrolases can break down waste products or some cells, phagocyte, debris of all cells, and also lysosomes degrade these debris. Yes? So hydrolases are important for degradation of internal cell waste materials and also for the waste products of other cells. They are very similar to stomach. Or if you look in the stomach, there you have enzymes for degradation and very low pH. And also in lysosomes, you have low pH. The pH is about 4, 4.5. Normal pH is 7. Yes? So you can say, and you can remember that lysosomes are small stomach for the cell. Low pH and lot of hydrolysis that degrade compounds. So, what do you think will happen if you have some enzyme defect? For example, the alpha-galactosidase. What's the consequence of this? One small enzyme.
Things will accumulate.
So, accumulate the substrate of the enzyme. Yes? The problem is that when you have one enzyme defective, then the substrates of this enzyme accumulate. The accumulation is very severe in two types of cells. First are long-living cells. Do you know some cells that, if you read? So some cells in our body we need for the whole life. Yes, some cells cannot divide through our life. For example, our neurons, cardiomyocytes in heart also do not divide. So these cells, when they want to degrade their own waste, they need lysosomes. and they need to do this 60, 70 years. So therefore, the long-living cells are especially affected. And then also macrophages. Why are macrophages affected by the accumulation?
Because they eat other cells?
They eat other cells, not only our cells, but they eat also bacteria, viruses, and so on. Yes? So macrophages are professional phagocytes. Yes? Their function is to phagocyte things, digest them, and make them inactive, the bacteria, for example. So therefore, these two cells are affected. For the problems in lysosome, any other accumulation, therefore we call it lysosomal storage disease. On this picture, there is the simplest scheme where the problem. This is our lysosome. Here we have waste. So what happens is that you accumulate the waste products. If you put it under a microscope, it looks like this. This is a picture from electron microscope. This is our endothelial cell. It means the cell that surrounds our blood vessel. Yes, the inner surface of blood vessel. And these black spots are lysosomes. Normally you cannot see them. If there is a problem, you see big lysosomes that are full of something strange. Here is the black material. Yes? So this scheme and this how it looks like in our body. Here only you do not have to learn this. The Fabry disease is the problem in one enzyme. This is the metabolism of compounds that are called sphingolipids. You will learn about them in the second course. So this is the whole metabolism. Here we have the enzymes, and you see that every enzyme can be defective. The red is the name of the disease. And here we have Fabry disease. So you can see that only if you block this and everything other is correct, you have a very big problem, the same problem as John. We as a doctor call John's problem as progressive multi-organ impairment, especially kidney failure, and then the cerebrovascular and cardiovascular problems. Yes? So kidney, he has protein in urine. Cerebro, the problem is he has pain. It's due to the problem in nerve system. And then cardiovascular. The problem, he has shortness of breath. Yes? Here you can see some pictures. Can you see it or not? So I will turn the light off. So, what organ we have on the picture? It's not very good. It's the magnetic resonance imaging, and this is our heart. And the problem here is that heart cardiomyocytes are long-living cells. They have long of waste material, and through the years the cardiomyocytes are bigger, bigger, and bigger. So this is not the normal size of the heart. Yes. It should be only so. Yes. If the cells are bigger than normal, we call it hypertrophy. The problem is in heart, so it's hypertrophic cardiomyopathy. Yes. Therefore, John has shortness of breath. The same here. You can see here should be bigger space. It will be seen better on your computers, not here. When there was the suspicion on this diagnosis, doctors do the renal biopsy. Yes, they took a piece of kidney They put it under the light microscope. They used special dye, and these blue spots are the deposits of the sphingolipids. Yes. So John has problem in kidneys, therefore he has protein in urine, and therefore he needs the dialysis. Due to these things, you see that it's different. In heart, the waste product is inside the cell. Here are the deposits outside. Yes, for in kidney, the cells are long-lived. The questions for you: why are John's sons healthy, and why could daughters inherit this disease?
Because it was located on the X chromosome.
So why on X chromosome? Explain.
Well, females don't inherit the Y chromosome, and if you inherit the X chromosome and the disease is there, and when the other one fails, I guess you get the disease either way.
It's recessive.
So, John can be father of son and daughter. Yes? What will give John to son? What chromosome? Y chromosome. Y chromosome is healthy. So the son has to be healthy. Of course, there is possibility that the mother has it also. So it doesn't matter. John to daughter is what? The X chromosome. So therefore, the daughter can inherit this disease. Yes? It's the typical sign for the heredity bind to X chromosome. Yes? Sons are unaffected, and daughters can be carriers of the false gene. Problem in Fabry disease is that even one X can do the disease. Not so severe, but it can do it. Yes? It's a bit untypical for diseases bind to X chromosome, but the Fabry disease, the defect is so severe, even one X will do something. This disease is quite old. We know about it more than 1 century. Yes, it was discovered at the end of 19th century by 2 dermatologists, and also now only dermatologists find out this disease. Those strange red spots everywhere on the body. It was discovered by 2 persons, therefore in some books you can read that it's not Fabry disease, not Anderson's disease. For example, if you study from the Robinson pathology, there's Anderson disease. Or here in Czech Republic, we derive our nomenclature from German nomenclature. We use the name Fabry disease. Yes? Somewhere is written Fabry Anderson disease.
So what is with the liver? Is it
I don't understand.
the liver?
The liver.
Yeah, did you also get problems with the liver or not?
In the liver, there are also problems, but they are not so severe to cause the liver failure.
Okay.
Yes? So we can say that everything in his body is somehow disturbed. Also the retina, yes? The patient has very often problem with eyes. Yes? In the liver also, but it's not so severe to do this. Fortunately, the liver has very high regenerative potential.
And what caused the red spots? What is
Red
it?
spots is the accumulation in the skin cells.
Okay.
Yes. Yes. The signs are more severe. Yes. The problem is almost everywhere. Some patients suffer also from dementia. John is lucky for he has no dementia, but some patients also. So they will call Fabry disease.
How many people have it?
Quite rare. It's 1 to 40,000. Yes, it's the most common lysosomal storage disease, but all these diseases are quite rare. But for example, if you focus, it's quite rare if you focus on the whole population. But for example, if you focus only on patients in dialysis, it's 2% of patients that need dialysis. If you only focus on patients that have cardiomyopathy, it's 5%. Yes. So nowadays, due to the infusion therapy, we have 7-8 years. Very often we found it when the patient has red spots. The heart problems start to develop when they are 40. So nowadays, due to the treatment, the patients sometimes do not develop the heart problem. Yes. So it's rare disease, but if you decide to do cardiology or nephrology, you will see those patients. And if you are dermatologist, then you will be the good guy. So, do you have questions to this?
Is there a real solution to heal the patient?
Gene therapy.
Yeah.
Very important to give the gene, but gene therapy, we do it right now. Yes, in some cases, not in this case. The first cases of gene therapy was the cases of severe immunodeficiency due to deficiency of adenosine deaminase. It's, I think, about 10 years when they started to treat small children with this immunodeficiency with gene therapy. Yes. For Fabry disease, we have the 7 years infusions. It's quite expensive. It costs per one patient per year 5 million crowns. Yes. In Czech Republic, in Prague, we have about 100 patients, 150 patients. But here is the big center. Yes, it's almost from the whole body. Yes. The gene therapy is the treatment for all these metabolic diseases.
What's in the infusion? What's the
infusion? There's the enzyme, alpha-galactosidase. And it's not so easy for, you need the enzyme to be in the lysosome. So it's not the pure enzyme. The enzyme has found galactose on its body, and the enzyme is taken by the galactose receptor to the cell and then transported to the lysosome. Yes. Unfortunately, the side effect of this enzyme is, of course, that not all enzyme is taken to the lysosome.
Yeah.
So some of the enzyme is in the extracellular space, and therefore the patients feel sick. Yes. So do you have any questions? So you see that one problem, one organelle that will cause structural problem, and you have problem in kidneys, in heart, in eye, in neurons. Yes? So do you want to end now, or you can do the second piece report? Second. So then, the second problem is the structure. You know, Fabry disease brings only drawbacks to your life. There's nothing good in this disease. But we have some diseases that can really help you. Yes? Maybe you will die earlier, but also as a famous person. So, in the second case, we'll try to answer the history question. Why could Paganini so good at violin and Rachmaninoff so good piano? I think that all of you know who was Rachmaninoff and Paganini, so only small repetition with nice pictures. So Niccolò Paganini was Italian violinist, guitarist, composer, and very famous virtuoso. Sergei Vasilievich Rachmaninoff was Russian pianist, composer, and conductor. Yes. Unfortunately, there is no Nobel Prize in music, but I think that for what was typical for both of them? Both of them had long arm and leg. They were tall and thin. Their fingers were long and also thin. This sign we call arachnodactylia. What is it, arachnodactylia? Yes, light fibers. Yes, so long, thin necks. No, light fibers. So your hands are spiders. And they have flexible joints. Yes, so they can do things that I cannot do. And these last two mentioned symptoms or signs enable them to be very good music players. Paganini violin, Rachmaninoff piano, but I think that they also switch. Yes? What is also typical for them, both had eye problems. According to current knowledge, we aren't sure, but we think that both these virtuosos suffered from some disease that affects the connective tissue. And I've already said that connective tissue is everywhere in our body. Yes? It forms some structure that you can see as, for example, tendons. It means the connection of muscle to bone, or ligaments that are important for our joints. Also, it forms cartilage in joints. In our heart, it forms the heart valves. Yes, you know that in heart we have chamber and atria, and the valves separate these two spaces. They also form, connective tissue forms the walls of blood vessels, especially of the big blood vessels as aorta. And the disease that we think that both suffer affect this connective tissue. And the result is that connective tissue is not so strong. Yes, it's weaker. And we think that both suffered from Marfan syndrome. Marfan syndrome is also simple disease. One problem that's quite uncommon. Myocardial infarction has 20 causes. Stroke has also 30 causes. Hypertension also. Marfan syndrome, the same as Fabry disease, with one problem in one gene. Now it's a glycoprotein that encodes fibrillin. Sorry, gene that encodes glycoprotein. That's called fibrillin 1. Why we need the fibrillin? You will learn it in this course that it's molecule that uses the connective tissue as a scaffolding for other proteins. Yes? If you want to build a house, the workers need to have the scaffolding to build the house. And the same is here. Yes, the fibrillin make microfibrils, and on these microfibrils, the elastin, that's important compound for the elastic fibers, can mature. Here you have some chemical sign how it works. Yes. Important is that this gene of fibrillin is not X chromosome, but it's on chromosome 50. Yes. Here you can see what the consequence is. Does somebody know what tissue this is? That's our aorta, yes, with special dye for elastic fibers. And here you see the wall of our. If everything is okay, these purple or blue spots, lines, are the elastic fibers. So you see that in our aorta we have very proper arrangement of elastic fibers. Why it's important?
Process so high pressure.
For the heart, as this, and 60-70 milliliters of blood goes to aorta. So the aorta has to expand during systole, and then during diastole, it has to collapse. Yes, or return to the normal shape. So therefore, there is so many elastic fibers. Yes, that's the tissue where you have the highest percentage of elastic fibers in our body. And here you see if you have Marfan disease. So there's no scaffolding. So you have their elastic fibers, but they aren't arranged as normal. This change has many positive and many negative consequences. The positive consequences is that you have long fingers, longer bones all in your body. You have more flexible joints, and therefore you can very good play music instruments. What do you think are the negative consequences of this? What can kill also the patient? And we think that Paganini died due to this.
The dilation of the aorta, for example.
So dilatation of aorta, where the aorta isn't able to reduce its volume in the diastole, so you have dilatation, and at the end you have rupture. In 30 seconds. So that's one big one bad consequence. What else? What? Yes. Where do you think that why they have eye problems? What we have in the eye, where can you put? Yes, the lens is fixated in its position by something. Yes, it's a fixation apparatus, they are muscles, and they are also small ligaments. Unfortunately, they are elastic ligaments. So, if I skip this, here you see the lens, but it should be here. Yes. So, the way the lens moves through the eye. Yes. And if you do not have lens, you have myopia. Yes, or you are missing one important part of your eye, or you can take. Unfortunately, in that ages it was not so easy. What else can be the problem? So heart, aorta, and vessels. Then we have eye problems. You think that it's good that all your joints are flexible?
Maybe you get joint problems. And
Yes.
the knee, for example.
Yes, especially the joints that have to, where you have to stand, so the knee and hip, they suffer from arthrosis. Yes, so very often when they are 40, 50, they have very severe pain in these joints. Yes, and also our spine. Yes, very often they have the deviation. You know how it's called, the deviation of the spine? Scoliosis. Yes. Very often they also have the gibus. Yes, so they use like this. Yes, for the vertebrae can move. Here you have the picture. There's also magnetic resonance. Here we have the picture of the dilatation of our. Yes. The bulbous of aorta is very wide and it can do the rupture. Here we have Y, so it was very good, so I have to skip some pictures. In the heart can be also a problem in the heart valves. Yes? But if you decide, do you want to be an unfamous person in 19th century or do you want to be Paganini? Yes. So some patients with Fabry disease also now in Czech Republic are very good music players. Yes. We know that they maybe will die when they will be 40, but unfortunately we can look at the aorta so we can see whether the dilatation is very high or not. Yes. So even now this problem is. This problem we cannot cure. There's no treatment. Yes, but even now, some famous Czech music players have Marfan syndrome. The question is, what was the risk for inheriting this disease for the children of Rachmaninoff and Paganini, and whether the risk was higher for boys and for girls? It's chromosome. So the risk was the same or different? So the risk is absolutely the same. For the X chromosome separate, so the X chromosome separate differently boys and girls, but the normal chromosome 15 separate. Yes, normally. And the risk was 1 in 4. Why 1 in 4? It can be also correct. It's not, but it can be. For you do not know whether this is dominant or recessive. So tell me why 1 in 4.
Thinking that it's only on one of the 2 chromosomes if it's dominant, and you have one pair of each chromosome, and then you get another pair from the mother or mothers.
So if this disease would be recessive, the risk will be 1 to 4. This disease is unfortunately dominant. Yes? The problem is that you have defective scaffolding. So it's enough to have one defective scaffolding and you have destroyed structure. Yes? So it's dominant and then the risk is 1 to 2. Yes? So 50% is problem, 50 are healthy. And it doesn't matter whether boy or girl. Yes? But you will learn in genetics that it's not so simple. For some girls will also have problems, even if it's more complicated. You will learn in genetics. Yes? Or you will learn in genetics that during the fetus period, some X chromosome is inactivated, some stays for the whole life. Yes? And this shifts the ratio also. Yes, and unfortunately, some diseases like not to be inactive. So this is the picture. So this is not the boy or girl; it's something in the middle. Yes, and you see. Or if you see the hair is something in the middle between mother and father. So it's unspecified unisex child. This disease is also quite old. It was discovered in the beginning of the 20th century. Yes? Sorry, the end of 19th century. The same as the Fabry disease. Yes? It was discovered in France. There was a small girl that has severe skeletal abnormalities, and the guy Marfan, first professor of pediatrics in France, when this girl died, not due to Marfan, but due to tuberculosis, then he took some tissues and he saw the aorta something strange, or maybe the pathologist. So there's something strange, yes? And therefore the disease is called Marfan syndrome. And here we have Paganini on his deathbed. For Paganini died with, we think that the signs are very similar to the rupture of aorta. Not if you have very fast rupture, you die. But if you have something, only smaller rupture, then you can die within 2 or 3 hours. And the description of his death seems to be very similar to how we think you die if you have a rupture. Yes? So maybe he died, maybe not. It was 17th, 18th century. We are not sure. So that was the other example of disease where you have impaired small protein. But you can see that not only drawbacks, but also some pluses. So do you have any questions? This disease is more common. It's about 1 to 15,000. Yes, so it's more common than the other disease.
How could you treat it? Could you help patients or not related?
This disease cannot be treated, also not by the gene therapy. The problem is that from the beginning of the development, we have impaired structure of aorta, heart valve, joint, everything. So only we can do a symptomatic treatment. You can do the transplantation part, or you can put there new valves. In the aorta, you have to do the most often the magnetic resonance to see how severe is the dilatation, or also by the sonography. And if the dilatation is very high, then you do operation, or through the aorta you give there some membrane. Yes, that you do.
So
Nothing else. With the joints, you can replace the joints, that's quite common. So that you can do, the biggest problem is the aorta and the heart.
So now, if someone has Marfan syndrome, how long can the patient live?
It depends. It depends. The biggest problem is the rupture of aorta and the heart failure. With the heart failure, we can treat. In the rupture of aorta, you know there is no border when it's so severe and sometimes. Yes, there is some classification that if it's solved, you do the operation. But sometimes it can rupture even if it's 1 millimeter small. Yes. For example, before 3 weeks, died here a very famous actor due to rupture of aneurysm of aorta and abdomen aorta. It was absolutely clear to all doctors that he has it, but due to classification, it should not be the rupture. Yes, it was not so big, we know, but it was not indicated to the operation. So the same problem here. Before this treatment, it was about 30, 40 when they died. Today, if the treatment is good, they can live normal life. If you can prevent the rupture of aorta and the heart failure. Yes? And of course, you have to replace the joints, especially the knees and hips.
Why was the patient so skinny? Why were they so skinny, thin?
It's also for your bones like to grow in the length, so they are longer. Yes. At the beginning, the bones are also connective tissue. Yes. In the histology, they said that bones are kinds of connective tissue. Yes. So the bones like to grow in length, and not so. So therefore, they are thin and very cold. And the problem is that since the beginning. So also the babies have more often fracture during birth. Yes.
do they have during her life some symptoms like heart insufficiency?
Insufficiency. Yes. Heart insufficiency is that your heart isn't able to do the work. The work is to give the blood to the body. They have problems in aorta. That's one problem why they can have the heart insufficiency, and also especially the valves. Yes. For normally the valves have to be very precise in closing the two spaces. Here they aren't so precise, so the blood can go back. So very often they have problem with the left heart. Therefore, they have shortness of breath for the blood accumulates in the lungs.